Hi, I'm Brooke, and I'm a nurse practitioner around here, and I want to talk to you today about your 2-week post-operative visit. So first off, congratulations, you made it to your 2-week post-operative visit. These first 2 weeks are truly the toughest with getting your fluid in and your protein, and you're recovering from surgery, so great job. You made it past the toughest recovery point. Things we want to talk about and cover today are your protein intake, your fluid intake, and making sure you are getting up and walking about. So first off, your protein intake. Make sure you are getting plenty of protein within your dietary restrictions. So you should be advancing from your full liquid to your soft foods diet. So that means that your protein shakes and things like that can decrease as you get more protein from your foods. Remember to reach for those goals that we set for you preoperatively. And work to achieve those every day. Second thing is your fluid intake. Fluid intake is essential, so making sure you're getting plenty of fluids all day long. 64 ounces is your goal, and that can be the equivalent of about 4 ounces an hour, but you can't get too much. So if you're getting more than 64 ounces a day, perfect. Keep going with that. Third thing we want to talk about today is making sure you're getting up and walking about. You are under a weightlifting restriction, nothing over 10 pounds at this moment, which lasts for 1 more week, but we do want to make sure you are getting up and walking about. Walking helps with so many things, working out your gas, preventing postoperative DVTs or PEs or things like that, and promotes healing throughout your body. So make sure you are getting plenty of walking every day. Some other things we want to talk about are your vitamins. Make sure you are taking your vitamins just like we talked to you about before you had surgery. Whether you had a sleeve or a switch, that's very important after surgery. Some other things to talk about are your other medications. You should be taking a blood thinner medication, so continue doing that as prescribed. And the other medication that's important right now is your acid reflux medication. We want to make sure you're taking that every day for at least the next 4 weeks until you reach the 6-week postoperative mark. At that point, we will talk to you about decreasing your use on that and hopefully get rid of that medication. Some other things to go over today are your incisions. You should have anywhere from about 5 to 7 incisions on your abdomen that are looking a lot better than they did at first. They should be coated with some glue on the top. Now remember, there's no need to pick or pull or anything like that at that. That will just continue to fall away as your incisions heal. Remember not to submerge your incisions until they are completely healed. So usually about 4 weeks out from surgery. So that means no soaking in a bathtub, don't get in a swimming pool or hot tub or anything like that. Showers, of course, are perfectly great. Just let the warm soapy water rush over your belly. No need to scrub or pull at those incisions. So some common problems after surgery, one of them includes constipation. So remember to be taking your stool softener every day, twice a day if you're needing it. And if you're needing a little extra help, you can take a laxative of some kind over the counter to help aid you in getting the bowels going so that you're not suffering from constipation. However, if you swing into the other direction and you're having diarrhea, stop your stool softener and make sure you're getting plenty of fluids. And if you're concerned, please contact the office so that we can visit with you and make sure things are going okay. Some other problems that I can see after surgery are include nausea. So remember, we prescribe for you a nausea medication to use as you need. So please use it if you're needing help with nausea and things like that. If your nausea is severe or you're having significant nausea and vomiting, please also reach out to the office for additional counsel on that. And another issue that I can see commonly after surgery is fatigue. And that is very, very normal at this point. You have just had surgery 2 weeks ago, so I expect you to feel tired, especially if you've gone to work during the day and you come home and you just feel wiped out. That's very normal. It will get better, so hang in there. Especially as you can advance your diet, have more calories, things like that, your fatigue will certainly get better.